member for London West.
Thank you, Speaker. My question is to the Minister of Health and Long-Term Care. A Freedom of Information request at London Health Sciences Centre revealed that since 2014, 6,190 alternative level of care patients have waited more than 100,000 days in the hospital. That's the equivalent of almost 300 years. These are often elderly and vulnerable people who could be discharged but have nowhere to go. The result is so many patients being treated in the hallway that earlier this year, LHSC was forced to implement a hallway transfer protocol. Speaker, Londoners deserve to know, what is the plan to address the shortage of beds, not just in our hospitals, but in the community as well?
Minister of Health and Long-Term Care.
Well, I can certainly agree with the member that the number of people who are alternate level of care patients in our hospitals is not acceptable, but that is what we inherited after 15 years of the previous Liberal government that unfortunately propped up. That is not something that just happened overnight. That's been growing and growing and nothing has been done about it. But we are going to do something about it. That was one of our central campaign promises, that we are going to end hallway health care. We promised and we're delivering on our promise to create 5,000 long-term care beds, 15,000 long-term care beds in the first 5 years, and 30,000 in 10 years. We've already announced 6,000 beds that are already in the works, and we're working on that each and every day.
Supplementary.
Speaker, the problem in London is getting worse. 621 alternative level of care patients are at London Health Sciences Centre already by August this year. So far, this government's commitment to new long-term care beds has come without firm timelines and with little transparency. We've heard an announcement about flu surge funding, but none of the funding has been allocated to London. Speaker, after a decade of Liberal cuts, my community needs stable, permanent funding for hundreds of beds. We need beds in the hospital, we need beds in transitional care, and we need beds in long-term care. Will this government commit today to sustainable long-term funding to fix London's hallway healthcare crisis?
Minister.
Everything that we have announced so far has been absolutely open and transparent and will continue to be. We've already announced 6,000 beds that are in production. They're actively working on that. There's no firm timelines because it depends on production, what is actually being done in each individual project. But I can assure you that they will be in operation as soon as possible, because we know that there are already over 30,000 people, not just in the London area, but across the entire province. They're waiting for long-term care beds to be created. So that is something that we are looking at each and every day in the Ministry of Health. We're not waiting 6 months, any long period of time to create those beds. As soon as applications are ready, we take a look at whether there's a need in the area, where the other locations are, and whether they're introducing innovation and what it is, what the project is that they're introducing. So we are applying the correct objective criteria to each application, and we are moving on it as soon as we can every day.